It's me again, Pharma. I hope you're not sick hearing me blubber and talk, because today I'm gonna share to you another favorite drug of mine. You heard me right, favorite drug of mine. Let me give you a clue. She's good for the heart. Any idea? Now let me just tell you since I'm too excited myself. She goes by the name ACE Inhibitors.
I just heard my name. Are you talking about me? I hope you are.
Yes, we are talking about you. Mind introducing yourself?
Oh sure. Hi. My drug name is ACE Inhibitor, short for Angiotensin Converting Enzyme Inhibitor. But that's just one of the many names that I have. For my generic name, you can call me Benazepril, Captopril, actually anything that ends with pril, that's probably me.
Indeed, she has a lot of names. Sometimes I call her with her brand names like Lutensin, Capoten, Vasotec, Acion, Monopril, and the list goes on. She even has a chemical name. But let's not get into that since it's too long. I'll just flash it on the screen so you guys can see it.
That's all for my name. Now, let's tackle about my two drug classification. For my therapeutic classification, I am considered as an antihypertensive agent, whereas for my pharmacologic classification, I am considered as an angiotensin converting enzyme inhibitor.
She is marked as Category D in pregnancy category. This indicates that there are evidence of human fetal risk, but drugs on this class may be used in pregnancy if the benefits to the mother outweigh the risk to the fetus.
Oh, so you know me so well, huh? It only shows how good of a pharma you are. But anyways, let us continue. For my mechanism of action, I act primarily through the blockade of angiotensin converting enzyme. This enzyme converts angiotensin 1 to angiotensin 2, a powerful vasoconstrictor and stimulator of aldosterone release. This blockade results to a decrease in blood pressure and aldosterone secretion.
Her pharmacokinetics shows that all ACE inhibitors are administered orally, but enalapril can also be administered through parenteral administration if oral use is not feasible. She is well absorbed in the gastrointestinal tract with the exception of enalapril if given through IV. Some ACE inhibitors are known to penetrate into kidneys and vascular tissue during distribution.
I am metabolized in the liver and in the gastrointestinal mucosa to active metabolites, and I am eventually excreted in the feces or in the urine. Some traces of me are detected in breast milk, and I am also known to cross the placenta whenever used during pregnancy. Do you still follow? Because I know information about me can be overwhelming at times. But still, I do hope that you extend patience in getting to know me more. Now, let's move on to my indications.
She is indicated for the treatment of hypertension alone or with thiazide diuretics, and can also be used in all grades of heart failure, usually combined with beta blockers. And if I remembered it right, she's also indicated for treatment of stable patients within 24 hours of acute MI to improve survival and reduction of risk of MI, CVA, as well as death from CV causes.
And there's more. I am also indicated for treatment of diabetic nephropathy, left ventricular dysfunction post-myocardial infarction, and asymptomatic left ventricular dysfunction.
If she has indications, she also has contraindications. Right, AC?
You are absolutely right. Patients cannot use me under certain conditions. I am contraindicated to those patients who has history of angioedema, impaired renal function, heart failure, bilateral renal artery stenosis, or to those patients who are pregnant, lactating, or has an allergic reaction to me.
Next on the list is her side or adverse effects.
Yet again, another part of me I'm not proud of.
Don't be so hard on yourself, AC. Certainly the good in you outweighs all the bad. So cheer up, cause you're more worth it than you think you are.
Thank you, Pharma. I really needed that.
Anytime, AC. So shall we continue? Her adverse effects include tachycardia, angina pectoris, alopecia, photosensitivity, ulcers, anorexia, neutropenia hyperkalemia, and hypoglycemia.
I can also cause cough, body malaise, dry mouth, lymphadenopathy, angioedema, and more. Actually, there's a lot, so I'll just flash the rest on the screen.
Now we are in the most important part, so lend me your ears, especially to those who are aspiring nurses. Let's talk about nursing responsibilities for patients receiving ACE inhibitors. The things a nurse must do before administration of AC is first to assess the presence of mentioned contraindications such as allergies to the drug, pregnancy, lactation, impaired renal function, salt or volume depletion, and heart failure to prevent potential adverse effects.
Next, assess baseline status before beginning therapy to determine any potential risk. Baseline data includes weight, vital signs, overall skin condition, laboratory tests like renal and hepatic function test, serum electrolyte, and complete blood count with differential to determine the client's response to the therapy.
Also, educate the patients on the importance of healthy lifestyle choices, which includes regular exercise, weight loss, smoking cessation, and low sodium diet to maximize the effect of antihypertensive therapy.
During administration, make sure to administer me on an empty stomach 1 hour before or 2 hours after meal to ensure optimum drug absorption.
The nurse must also provide comfort measures to help the patient tolerate drug effects. He or she can also provide thorough patient teaching about AC, the drug which the patient is taking, to enhance patient knowledge and promote compliance.
And lastly, monitor for any presence of manifestation of decreased in fluid volume such as diarrhea, vomiting, and dehydration to prevent exacerbation of my hypotensive effect.
After drug therapy, the nurse must proceed with evaluation to determine effectiveness. This includes monitoring the patient's response to the drug if he or she was able to maintain BP at normal limits.
And before we forget, the nurse must monitor for any adverse effects that I might have caused. Oh, how I hope there's none.
I hope so too, and I think that's all there is to learn about you, right? We didn't miss anything?
Yeah, I think that's all. And if we happen to miss anything, you guys can look it up on drug handbooks, on the web, or any source that you might prefer.
Thank you all for listening. I hope you learned something somehow. And of course, thank you AC for sharing with us how beautiful you are.
Thank you for having me as well.
Bye!